We're just at the level of having a quorum, and I know there are others who will be arriving shortly, but we need to go in and get started because we have quite a bit of work to do this morning. Good morning. Good morning. And welcome to the Senate Committee on Education and Health. Clerk, would you please call the roll?
No, sir. But you never know. You have a quorum, Madam Chair.
Thank you very much. Today, we have 50 bills on the docket. After today, each subcommittee will meet once, and we will have additionally full committee next, and I think the next meeting is going to be next Thursday. So I say again, after today, each subcommittee will meet once, and we will have one additional full meeting next Thursday. The Public Education Subcommittee will not meet this afternoon. This committee will meet on Wednesday morning, and that time is to be assigned. Each of the bills on the docket today fall in three different categories. Number one, bills that are identical to Senate bills, bills that are similar to Senate bills, and bills that pass unanimously from the House. For bills that are identical and similar to Senate bills, we've already considered. Our staff will review each bill, and we will vote on them individually. We will only hear from patrons if it is absolutely necessary. Then we will consider bills that passed unanimously from the House. In order to efficiently handle the large volume of bills that will be referred to this subcommittee or to this committee.
To Senate Bill 1072, patroned by Senator Bell, which reported from Education and Health 15-0. There is a minor substantive difference, so we do recommend conforming to the Senate bill, and it was not requested by Finance.
You heard the motion? All in favor say aye. Aye. Now on the motion? It's been moved and properly seconded that the bill be reported without conforming. All in favor of that motion? Does someone have an unreadiness? There's a substitute motion that the bill be passed by indefinitely. All in favor of that motion, please designate electronically. The bill will be passed by indefinitely.
Madam Chair, next is HB 1629, patroned by Delegate Coiner. This bill is similar to SB 1329, patroned by Senator McClellan, which reported from Education and Health with a substitute 15-0, and was reported from Finance and Appropriations with an alternative substitute 16-0. It passed out of Senate 39-0 with the substitute reported from Finance and Appropriations, which converts Senate Bill 1329 into a Section 1 bill, making it significantly different from HB 1629. We do recommend conforming the House bill to the Senate bill. Additionally, HB 1629 was requested by Finance.
You've heard the recommendation of council to conform. All in favor? Sounds like the ayes have it. Now motion, please. And a second? It's been moved and properly seconded that the bill be reported and re-referred to Senate Finance with a substitute. All in favor of that motion, please designate electronically.
Ayes 14, no zero.
Ayes 14, no zero. The bill will be reported and re-referred to Senate Finance with a substitute. Madam Attorney.
Madam Chair, next is HB 1691, patroned by Delegate Greenhow. This is similar to SB 1099, patroned by Senator Normand, which reported from Education and Health with an amendment, and then reported from Finance and Appropriations with an additional amendment, 12-4. We do recommend conforming the Senate bill as reported out of Finance and Appropriation with both amendments, and it was requested by Finance.
You've heard the motion to conform. All in favor, did I get a second? Okay, all in favor say aye. Now motion, please. It has been moved and properly second that the bill be reported and be referred to Senate Finance with a substitute. All in favor of that motion, please designate electronically.
Ayes 13, noes 1.
Ayes 13, noes 1. The bill will be reported and be referred to Senate Finance with a substitute. Madam Attorney.
Madam Chair, next is HB 1840, patroned by Delegate Knight. This bill is similar to Senate Bill 1211, patroned by Senator Lucas, which was reported from Education and Health 15-0, but then was reported from Finance and Appropriations with a substitute, which converts it into a Section 1 bill 15-0. The recommendation is to conform the House bill to the Senate bill as reported from Finance and Appropriations with the substitute. Also, HB 1840 was requested by Finance.
Okay, you've heard the motion to conform. To get a second. All in favor, please say aye. Aye. Now motion, please. It has been moved and second that bill be reported and be referred to Senate Finance with the substitute. All in favor of that motion, please designate electronically. Thank you so very much.
Ayes 14, noes 0.
Ayes 14, no 0. The bill will be reported and be referred to Senate Finance with a substitute. Madam Attorney.
Madam Chair, next we have HB 1890, patroned by Delegate Tata, which is similar to Senate Bill 1356, patroned by Senator Reeves, which was reported from Education and Health 15-0, but passed by indefinitely in Finance and Appropriations 13-1. As the Senate bill is passed by indefinitely in Finance and Appropriations, there is no need to conform. The House bill can be passed as is.
Then all I need is a motion. It has been moved. Yes. You've heard the motion, you heard the second. All in favor of that motion, please designate electronically.
Ayes 12, noes 2.
Ayes 12, noes 2. The bill will be reported and be referred to Senate Finance.
Madam Chair, next is HB 1916, patroned by Delegate Batten. This is similar to Senate Bill 910, patroned by Senator Newman, which reported from Education and Health with a substitute 15-0, and then after crossover from the House Committee on Education, it was reported with an amendment, largely a technical amendment. It adds 2 words. So the recommendation is to conform the House bill to the Senate bill as amended by the House Committee on Education.
You've heard the motion to conform. All in favor? I've heard the motion. I heard a second. So all in favor, please say aye. Aye. Ayes have it. Now motion, please. It's been moved and properly seconded that the bill be reported with the substitute. And this is not being asked for by Finance. So all in favor of that motion, please designate electronically.
Ayes 14, noes 0.
Ayes 14, no 0. The bill will be reported with the substitute. Madam Attorney.
Next, Madam Chair, is HB 2185, patroned by Delegate Razul. It is similar to SB 1169, patroned by Senator Hanger, which reported out of this committee on a vote of 13-0 to 2. The Senate did adopt a substitute to this bill that made some substantive changes. Our recommendation would be to conform this House bill to the Senate bill.
You've heard the motion to conform, and there is a second. All in favor of that motion, say aye. Aye. Sounds like the ayes have it. Motion, please. It's been moved and second that the bill be reported with the substitute. All in favor of that motion, please designate electronically.
Ayes 14, noes 0.
Ayes 14, no 0. The bill will be reported with the substitute. Madam Attorney.
Madam Chair, next is HB 2187, patroned by Delegate Razul. This is similar to a part of Senate Bill 1043, patroned by Senator McPike, which was reported from Education and Health with substitute 15-0. The recommendation is to conform to the Senate bill.
It's been moved and properly second that the bill be conformed. All in favor of that motion, say aye. Aye. Ayes have it. Motion, please. It's been moved and second that the bill be reported with the substitute. All in favor of that motion, please designate electronically.
Ayes 14, noes 0.
Ayes 14, no 0. The bill will be reported with the substitute. Madam Attorney.
Next, Madam Chair, is HB 2190, patroned by Delegate Razul. The similar bill is SB 1270, patroned by Senator Edwards. That bill reported from the Committee on Rules and ultimately passed the Senate on a vote of 39-0. The recommendation for this bill is to pass the House version as it is without conforming, as the House bill contains consensus amendments worked out between the Joint Commission on Healthcare, DMAS, and impacted MCOs.
You've heard the motion not to conform. All in favor of that motion? It's been moved and properly second. All say aye. Ayes have it. Motion, please. It's been moved and properly second that the bill be reported. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported. Madam Attorney.
Madam Chair, next is HB 2264, patroned by Delegate Ransone. This is similar to Senate Bill 856, patroned by Senator Spruill. Senate Bill 856 was passed by indefinitely with the letter in Education and Health 15-0, and because of this, the House bill does not need to be conformed. It could pass as is.
Well, then we don't need a recommendation. We just need a motion. All in favor of Senator Howell?
Question, then, do we want to treat this bill the same as we did the Senate bill? Well, move to PBI. Second.
It's been moved and properly second that the bill be passed by indefinitely. That is House Bill 2264 with a letter.
We do have, Madam Chair.
The-
I would have talked to the patron. She said her bill is different than Senator Spruill's.
We do know that.
And if we give the patron an opportunity to explain why she is here.
It was explained when Senator Spruill's bill was presented and the bill was passed by indefinitely. And as you noticed in my remarks, I said that there will be no testimony unless absolutely necessary. So we're going to follow the dictates of the committee. And the motion and the second is that the bill be passed by indefinitely. All in favor of that motion, please designate electronically.
Ayes 11, noes 4.
Ayes 11, noes 4. The bill will be passed by indefinitely. Madam Attorney.
Next, Madam Chair, is HB 2274, patroned by Delegate Kilgore. This vote is similar to SB 948, patroned by Senator Suderline, which reported out of this committee on a vote of 14-0. There are a couple substantive differences, so our recommendation would be to conform this bill to SB 948.
Give me 1 second.
Nope.
Madam Chairman,
Senator Donovan.
I think that I think we need to discuss the substantive difference that's in this bill, and I think that we may not want to conform to the House bill. This, as I understand it, simply allows pharmacists who can test for COVID to initiate treatment once an algorithm is put together, and I think it was a consensus coming out of the House, and we may want to leave it in its current form, and that would be my recommendation, and that we do not conform.
You've heard the recommendation of Senator Donovan, and there is a second. All in favor of that recommendation, please say aye. Aye. Motion on the bill?
Second.
Without conforming? I need to hear the rest of that. It has been moved and properly seconded that the bill be reported without conforming. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported without conforming. Thank you. Madam Attorney.
Madam Chair, next is HB 2426, patroned by Delegate Freitas. This bill is similar to Senate Bill 1481, patroned by Senator Donovan, which was passed by indefinitely in Education and Health 8-7. So because it was passed, the Senate bill was passed by indefinitely, the House bill could pass as is without having to be conformed.
Substitute PPI.
There is a substitute motion that the bill be passed by indefinitely. All in favor of that motion, please designate electronically.
Madam Chair, I have a question. I thought the first motion was about conforming. Was that correct?
Yes, if you conform, exactly.
We didn't conform it.
If we conform it, the bill will pass by indefinitely because the Senate bill passed by indefinitely.
Thank you, Madam Chair.
You're welcome. Did we complete the electronic vote?
No, ma'am.
Barker?
Ayes 9, no 6.
Ayes 9, no 6, the bill will be passed by indefinitely. Okay. Madam Attorney?
Madam Chair, there is one additional bill in the similar category that was in the past unanimously category. That is HB 1704, patroned by Delegate Bell. This is similar to Senate Bill 821, patroned by Senator Surraville, which
Is that similar?
passed Education and Health 15-0 is unanimous. There are some substantive differences, so the recommendation is to conform the House bill to the Senate bill.
You've heard the motion to conform and a second. All in favor of that motion, please say aye. Aye. Ayes have it. Now we can entertain a motion. It's been moved and properly second that the bill be reported. All in favor of reporting the bill with the substitute, please designate electronically.
Ayes 15, no 0.
Ayes 15, no 0. The bill will be reported with the substitute. Madam Attorney.
Madam Chair, next we'll do two blocks of bills that were unanimously passed from the House. The first will be bills that were not requested by Finance, and the second will be bills that were requested by Finance. I will read the number, patron, and title of the bill, and if a member wishes to pull it out of the block, they can do so at any time.
You've heard the instructions. Madam Attorney.
First is HB 1403, patroned by Delegate Tata. It passed the House 100-0. Certain public institutions of higher education, provision of university housing at no cost to certain students during scheduled intersessions. Next is HB 1449, patroned by Delegate Orrock, Secretary of Health and Human Resources, administration of prescription medication by emergency medical services providers. HB 1492, patroned by Delegate Davis, Board of Education, Special Education and Related Services, certain evaluation deadlines. HB 1514, patroned by Delegate Adams, deceased high school seniors, waiver of graduation requirements and award of posthumous high school diplomas. HB 1575, patroned by Delegate Walker, Internet Safety Advisory Council collaboration, model instructional content and resources. HB 1638, patroned by Delegate Walker, Department of Professional and Occupational Regulation, Department of Health Professions and Health Regulatory Boards, disclosure of information regarding examinations, licensure, certification, registration, or permitting. HB 1698, patroned by Delegate Simon, Child Day Programs, exemption from licensure, certain programs offered by local school divisions. HB 1701, patroned by Delegate Cherry, certain private schools in the Commonwealth, disclosure of certain employee records for purpose of accreditation. HB 1737, patroned by Delegate Robinson, practice of optometry, licensing, and regulations. HB 1822, patroned by Delegate Avoli, public school employees, offense involving solicitation of sexual molestation, physical or sexual abuse, or rape of a child, penalty. HB 1982, Delegate Corey, public school principals, parental notification of certain student violations. HB 2375, Delegate Sewell, provisional teacher licensure, permissive extension, satisfactory performance evaluations during years of actual employment. HB 2429, Delegate Avoli, emergency care, exemption from liability, athletic trainers. HB 2457, Delegate Batten, public elementary and secondary school teachers, frequency of certain training activities, length of temporary teacher employment. HB 2469, Delegate Cherry, Department of Education, Standards of Learning Assessment Revision Work Group, timeline for request for proposal for provider of revised assessments. And that completes the first block.
Thank you, Madam Attorney. You've heard the reading of the numbers, the patron, and the summary of the bills, and that is all bills on page 23 to page 27. All in favor of reporting those bills in a block, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero, the bills in a block will be reported.
Madam Chair, there are two bills in our final block, and these were requested by Finance. So the first is HB 1512, patroned by Delegate Adams, State Plan for Medical Assistance Services, Durable Medical Equipment, Complex Rehabilitation Technology. The last bill is HB 1887, patroned by Delegate Byron, Local School Boards and Comprehensive Community Colleges, Compensation Structure for Adjunct Instructors, Credit-Bearing and Non-Credit Workforce Credentials.
You heard the motion to report and re-refer the bills in the second block, and that is all the two bills on page 28. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero, the bills will be reported and re-referred to Senate Finance. Are there any other bills or issues to come before the committee? Hearing none, the committee will rise.